Hi there everybody, Dr. Coletti on behalf of Baywest Health Rehab. Today we are going to do a Manipuflex procedure on Dr. O'Donovan, who's not so new, an associate of ours and with us here for now over 6 months, and we're very thankful for you and your services. And today we are going to do a Manipuflex on him. He's also having some lower back discomfort. So we're going to show you a full rendition of not only the Manipuflex, but the whole full distraction maneuver and stabilizing the pelvis and increasing that range of motion, and then finishing it off with the Manipuflex. Before we get to that, I wanted to share with you, it is official now that Manipuflex is a United States of America patent and trademarked. So the maneuver that we utilize is now trademarked. So if you see Manipuflex anywheres, it is a direct result of Baywest Health Rehab and myself. So we're going to do that Manipuflex today with Doc. Let's get your face down. Now, as you know, this is a full, we're going to do a little flexion distraction to open up in his pelvis and his lower back muscles. So we're going to first strap him in. Are you relatively comfortable, Doc?
Yes, sir.
Okay. And let's just say Doc is not 5'8". So we're going to strap him in, as you can see, in his upper dorsal area. All right. And we're going to do a little flexion distraction. All right, as you can see now, the flexion distraction is really opening up your spine. Is that okay, Doc?
That's good.
Good. And many of our patients like and appreciate the glorified car buffer we utilize, or technically the G rub. Now, a lot of times patients will ask me, and I get a lot of messages from patients across the country who want the Manipuflex procedure done. And as many of you know, the procedure I do, I learned from Dr. Johnson in Houston, Texas, who's, many of you have heard me say and call him the grandfather, because he's, the Manipuflex kind of was born from his maneuvers. And I've just added a bit of a twitch with kind of like any physician or doctor out there who's taking care of patients and getting them and their spines in balance and getting them out of pain effectively, efficiently, and affordably. That's what we do. And our results, we're very practice results, or results-driven practice. But getting back to what I was mentioning, a lot of people from all over the country want to come in and fly in and get the Manipuflex procedure done. And what I tell them is that there's we do a very thorough orthopedic and neurological examination. We will do x-rays and review any MRIs if they've got them, to review whether or not we can actually perform that procedure on them, because it's not a procedure that we can perform on just anybody on day one. So if a patient's from out of the country or out of the state and wants to come in, they need to spend 2 or 3 days here so we can make sure they're able to handle the procedure, the Manipuflex, but also that we might not do it on day one, because we want to kind of really moisten, loosen up the muscles and ligaments and prepare them for that procedure. So just an FYI out there. So we've gotten a good stretch here, and we're also going to include a little lateral flexion distraction here on Dr. O'Donovan. Yeah, you can feel that whole side just off, Doc. You gotta love adjusting a chiropractor, because they pretty much self-diagnose themselves before they lay down on my table. And so all my chiros out there, you know exactly what I'm saying. Just relax. I like to really kind of open up the posterior muscles of the pelvis, and when I'm doing so, it really opens up the muscles, the ligaments, the tissue in the hip joint, in the SI joint, to enable the adjustment to just be a lot smoother. And I certainly will not spend an hour on each one of these, but it is important to know that some patients, when we open up this posterior muscle group in the pelvis, some patients have a very low ability and tolerance to handle the discomfort. Like, Doc, I know you feel that, right?
Oh, yes, sir.
There's a lot of discomfort, but some also have a little different pain levels or pain tolerances than others. So we are not in the business of torturing our patients, as some patients, and you know who you are watching this video out there, might think, but this is more to just really open up the musculature. And frankly, the patients that are able to handle a little more discomfort at first seem to get better results quicker and faster. And I do not enjoy torturing the patients, I promise you. We're going to do a little drop work. Relax. And we're going to just do a little quick check. Relax. Doc, would you prefer I put you on your side, or?
That's whatever you're more comfortable with.
Okay. I think we're going to stick with just the shop right now, since I'm going to clear out everything above. Arms all the way down for me. And relax. Breathe in. Hold your breath. Breathe in more. Hold it. Hold it. And let it go all the way. Good. Good. Ah, beautiful. Okay, relax, relax. Let's get you to flip over. Okay, we're going to put this under your legs. Good?
Mm-hmm.
All right. Okay. All right, as you can see, we've got Dr. O'Donovan here now with his legs perched up, creating a flattening of his lordosis in his lower back. So as and when we strap him in, Doc, I'm going to ask you to raise your arms for just a moment, please. And we're going to take this. Good. And we're going to strap him in there. Good. Now he's going to be able to breathe, so we're not trying to kill him, but we really do not want this pelvis moving a whole lot. Good. Locked in?
Locked in.
Lock your hands underneath the bottom for me. And first we're going to just motion his neck a little bit. Head up and down. Good. And I'm just going to loosen this up just a smidge. And we're just going to stretch you a little bit. It's not too hot, is it, Doc?
No, it's nice.
Good. Relax. I like to just do a little subtle stretch of the neck. And this can differ depending on how much pain and discomfort the patient's in. If they're having a significant amount of upper back or neck pain, if they're too restricted or too guarded, this is not a procedure I would do. Certainly not on day one. Relax, okay. And head up. Now I'm going to fold my trusty towel, head up, down. Good. Okay. All right. Now that's not choking you, correct? Yep. Good. We're going to lower this a little bit. As you can see, his whole body is stabilized. Body's relaxed, he's locked in, hands are underneath. The reason why I put the hands underneath, because it allows somewhere for the shoulders to not have to be contracted. The hands under the bottom of his buttocks, as you can see, allow the just truly to relax. So when we do the Manipuflex procedure, he's wide open. And just relax, Doc. Loose he goes. Breathe in. And just relax. Good. More. Good. Ah, and loose, 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 loose. Let's just open that up. Good, good. And let's get that upper top here all the way. Good. Doc, how far down did you feel that open up?
That easily went down to the lower part of my mid back.
Lower portion of the mid-back, everyone's a little bit differently. Do you feel that immediate release?
Yeah. 2 inches taller.
2 inches taller. Dr. Coletti with Dr. O'Donovan, on behalf of Baywest Health Rehab. Manipuflex procedure, get in, get it done. It'll change your life and open up your whole body for a healthier and better life. We're out.